The Plastic Surgery Channel recently interviewed Dr. Lou Buckey, an expert in the field of fat grafting. He answers the question, what is fat grafting?
It originally was, can we do it or should we do it? And now the answer is yes, and how can we do it better? There have been tremendous advances in this very hot topic, if you will. Fat grafting to the breast has a lot of possibilities, and plastic surgeons have been very active at looking at the components, the safety, and the efficacy of that. In the last year alone, there have been 2 landmark papers, one looking at MRIs and the predictability of how well the fat stays in cosmetic augmentation patients. And according to that process, it's been very good. 2/3 of the fat stays, and the variability from patient to patient is significantly reduced. Just last week, there was another paper of a long-term study looking at fat grafting both in reconstruction and cosmetic patients with great reliability, using pre-expansion to help make that process more reliable. I think between that and some of the basic studies, we're learning a lot about fat grafting, and not only does it have a good role in cosmetic augmentation, but it has an excellent role in reconstruction, and it benefits both groups in revisions, in patients who are having problems with breast augmentation or breast reconstruction. I think that in this case, both clinical activity and science are going hand in hand. There's almost a race between which comes first. And I think that we're going about it now the right way. Fat grafting to both the face and the breast have been around for many years, but we haven't looked at it carefully. And this time, over the last 10 years, fat grafting to the breast has been proven to be safe. And now we're understanding how effective it can really be. And I think it's going to continue to advance and really change what we're doing both with breast implants to make breast implant and breast augmentation better, and also for those women who want breast augmentation without implants. And certainly for the group of patients that have had mastectomies and reconstruction and need and can now have a more natural, more aesthetic result. The sheer volume of fat that we can introduce into the breast, either over an implant or in place of an implant, allows it to be the ideal filler, if you will. If we think of the breast as having fat and breast tissue over muscle, by providing fat back into that same space only makes sense. And as long as we can do it reliably, I think that the longevity, the absence of maintenance, and the opportunity to make a natural breast is much better with our own fat than with a filler, for instance.